live and ready to go. Good afternoon. Let me start this afternoon by adding my voice to those offering sympathies and condolences to all families, to all Nova Scotians following the tragic weekend events. Like most of us, I'm trying hard to comprehend how something like this happens, and I can't. I was in contact with Premier McNeil on Sunday. I offered on behalf of all Islanders our love and support. As you can imagine, it is a raw and emotional time. Their province is dealing with the health, social, and economic challenges connected to COVID-19, which has been devastating and had devastating impacts. And now our sister province has to try to pick up the pieces after this senseless weekend of horrific events. I know as Maritimers and Canadians, we're hurting. I know also that we're tough and we're resilient. Somehow we need to try to find a way forward to keep going. I have offered any help and support to Premier McNeil and his province in the days ahead. He is appreciative of the gesture and tells me that for now the best thing we can do is to be strong, to hold our loved ones close, and to be grateful for all we have. So I wear this Nova Scotia tartan tie today as a sign of our sorrow and respect. I will call upon Dr. Morrison to provide our daily update in a few moments. First, I wanted to join Dr. Morrison here today because, as we've been indicating for the past number of days, we have been working at putting together a smart ease-back plan so that we can begin the process to bring some type of normal to our province after having spent the last number of weeks following very strict public health directives to contain and mitigate the spread of COVID-19 in our province. One thing we should not take for granted is the strong, rather unique position we find ourselves in as a province. We are able to talk about moving toward a plan that we, I guess, officially or unofficially call Reopen PEI Together, because we have done very well in containing COVID-19. We have done this because our Chief Public Health Office, under the strong leadership of Dr. Morrison, put in place strong early measures, and Islanders have heeded the advice. Let me say first that I could not be more proud of Islanders for how they have responded, for how serious they have heeded the messages, and how determined they have been as a society to keep one another safe. Some of those strong measures have included our screening process at the entry points to our province, the commitment and dogged determination of Islanders to adhere to a 14-day self-isolation when required, the broader testing and early measures put in place for long-term care facilities. In these and many other measures, I feel our province has led the country. And as we begin looking at ease-back, we must recognize that this requires us to act smartly, cautiously, methodically. We need to continue our strong screening process at our points of entry, as one of the biggest potential risks to our province has been and continues to be those traveling. We have and will continue to ramp up our testing. Any Islander who has symptoms needs to be tested. This not only helps you, it helps those around you. We will continue and we will need to continue to ensure that our most vulnerable are protected. As Islanders, I understand where we're at. It's been a long stretch. We are social by nature, and especially with spring in the air, I know we all feel the need to get out and to move around. Working gradually and following the advice of the Chief Public Health Office, I am confident we can get back to some normal activities, but we still need to continue to practice physical distancing, and we still need to be very careful in how we conduct ourselves. Like you, I want to see some regular activity return, as it's vital to us as a community of Islanders. The things that we used to take for granted, such as visiting family or friends or seeing our children, be able to socialize with their friends. The ability to support small businesses that have been the backbone of the economy of this province. We are getting very close to seeing some of these activities occur. We are in this fortunate position because Islanders have taken seriously their responsibility to follow public health direction. That responsibility will need to continue as we go forward. I feel confident, as does Dr. Morrison, that Islanders will continue to act responsibly and that will make it possible for us to continue to ease back in the days and weeks ahead. If we continue on this current trajectory, we would be able, hopefully, to begin part of that ease back on May 1st. But there's a lot of water to run under the bridge between then and now. Our plan, as we have been practicing to date, will, for the foreseeable future, err on the side of public health and safety. We have made incredible strides through the process of containing COVID-19, and we surely don't want to go backwards. As Dr. Morrison has been saying almost daily, we need to learn to live with COVID-19. And because we are still very early in the process and in these very early days, we will be cautious, careful, and methodical as we learn just how to do with that, to live with COVID-19. So to be clear, any ease back will be gradual. We will need Islanders to continue to be patient, to be understanding, and to continue to be part of the process so that we can get through this together. The job of the Premier of Prince Edward Island brings with it access to about 158,000 political advisors. That is one of the great blessings of the job, for sure, and as you can imagine, that advice is often sharp and direct, and it varies. As it pertains to our current situation, there are some who think we can kick the gates open widely and storm back to normal, and there are those who think we shouldn't budge at all, and there are those also in the middle who think we can make careful steps and that we need to give Islanders a flicker of hope so that we don't have to live like this forever. I certainly respect all of those views, and the one consistency in all of those positions is the desire to see Islanders safe and healthy. I know in my job as Premier that I can't make everyone happy, but I have to do everything I can to make people safe. Part of that is recognizing, as we have, that altering our lives so quickly, so dramatically to protect our population from this virus also brings with it unintended consequences and challenges that impact the health and well-being of Islanders. We need to safely, cautiously begin the process of our ease back, and we will. And I just would say that from day one, we have been following good advice, and that will continue. From day one, we've been trying to walk that very fine line of implementing measures to keep Islanders safe while doing everything we can to maintain some type of limited economic activity. That too will continue. And from day one, we have taken steps in the best interest of Islanders, and we have relied on the nature of Islanders to be responsible, and that must continue. We have come a long way in this short time, but we aren't done. We're not through this. We are in a better position than most, and now we are able to talk about some things that others can only visualize down the road. But that can change quickly if, as Islanders, we stop buying in or if we stop being vigilant. So with that, I'll turn it over to Dr. Morrison to get her daily update and also to thank her again for all the work she's done.
Thank you, Premier. The last few weeks have been so hard for so many, and they've been stressful. We've adjusted how we live, how we work, how we interact. And then, of course, with what has happened in Nova Scotia on the weekend, it is a very hard time. So today, I want to pick up on one of the words you said, and I want to focus on hope. Hope that PEI can get through this and continue to get through this pandemic safely. Hope that we can ease up carefully on public health measures and that everyone is healthy. Hope that we can continue to look after each other and our communities. And hope that we can learn in a new way to live, play, and work on Prince Edward Island. There are no new cases of COVID-19 to announce on PEI today. As I mentioned yesterday, and the Premier mentioned it as well, it's important that testing continues, and if you have symptoms of COVID-19 and really a range of symptoms, even mild symptoms, please call 811 or your family doctor or nurse practitioner to be tested. It is a key piece when it comes to preventing COVID-19 spread here on PEI and making sure we understand what is happening on PEI. We will continue to have discussions about increasing our criteria for testing, already testing people with or without travel history, and admissions to long-term care facility, healthcare workers with symptoms, and contacts of cases, even if they don't have symptoms, up to 48 hours beforehand. I want to mention that we have been continuing to follow up on complaints that have come into our office or police. There have been 80 official warnings given out and 9 charges laid. Our Operation Isolation, in terms of following up people who are arriving in PEI and who need to self-isolate, our calls at times over 1,300 a day being made to people. We talk about the border screening and how important it is. And I believe last week there were over 1,800 people screened through our borders. I know there have been a lot of comments about lobster fishing, and so I do want to mention that today. And I understand the lobster fishers were providing input into the federal decision regarding a possible delay for this year's season. And this is and will be a stressful time for fishers. I do have family who lobster fish, and I appreciate that these are not just rough waters, these are tough decisions too. Our office has been and will continue to work on providing support and advice for this industry, both on vessel and in processing. The Premier has spoken about the easing up of measures, and we've spoken about it here the last couple of days as well. And everybody is anxious to go into the next phase. And this reopen PEI together, or reopening PEI together in early May is certainly part of the process and the planning that we're looking at. We'll continue to do so based on public health risk. It's going to involve a process with consultation and a risk assessment with industry, government, departments, businesses, and communities. It will be a dynamic process requiring reassessment and readjustment frequently. We've referenced them, and I'll mention a couple again. For us to move forward in early May in easing up public health measures, we will need certain things to continue, and certainly control of our cases being a key one, testing being another one, control and monitoring the border screening to mitigate the risk of importation. We have to make sure that we don't see in the next couple of weeks widespread community transmission. We do not want to see any outbreaks at long-term care facilities. We want to make sure that before there's any ease up, that there is PPE or personal protective equipment available at long-term care facilities, both public and private. And if we are able to meet these type of criteria, certain outdoor activities and elective procedures in our health system will be 2 areas where we will start. When we go forward, we are working on this together, and working on it together does not mean we do everything together at the same time. It means each of us and departments and communities have a role to play. We will move forward carefully and gradually. We will monitor closely, and we will do it one step at a time. Thank you. I might want to add one more thing as I keep going here, and I think, and it's that. And it's almost going back to the beginning, that these 6 weeks, last 6 weeks haven't been easy, and we will need to continue to be thoughtful, deliberate, and patient. And so I ask each of the islanders, who I'm also so proud of and have made a difference in our province, in what our pandemic has looked like. And I ask all of us to be patient, to be kind and look out for one another, and continue to connect in new ways and show that we care. Thank you. OK, je vais dire juste quelques mots en français, vraiment. Bon après-midi. On n'a pas de nouveaux cas de COVID-19 ici à l'île du Prince-Édouard aujourd'hui. Mais je mentionne encore, c'est très important d'être testé si vous avez des symptômes de COVID-19. C'est important pour qu'on sache les cas ici ou pour identifier les cas, pour faire les contacts. Je mentionne aussi qu'on on parle de relâchement des mesures ici à l'île du Prince-Édouard. Mais pour faire ça, le premier bout de mai, on doit faire attention qu'on n'a pas beaucoup de cas avec des transmissions communautaires. Il faut avoir on ne veut pas avoir des outbreaks dans la communauté. Et puis, on doit continuer la vigilance vraiment aux entrées à l'île, au pont et à l'aéroport. Mais si on fait ça et on fait ça ensemble, la possibilité d'avoir un plan avec pour regarder le risque serait important pour commencer. Merci à tous, merci à nouveau à tout le monde de continuer à suivre les directives. Et je sais que c'est pas facile et c'est depuis 6 semaines vraiment que chacun de vous fait une grande différence pour aplatir la courbe. Et ces actions aident à minimiser la transmission de ce virus à l'île du Prince-Édouard. Et prenons soin les uns les autres. Continuons de trouver des façons de rester connectés. Et ça fait partie de que nous sommes comme insulaires, d'être bons les uns envers les autres. Merci.
Thank you, Heather. We will now take some questions from our friends in the media.
Nicole Williams, CBC.
Yes, hi to you both. And actually, my first question is for the two of you. If you could both answer, please. This is the first time we're hearing a specific date, May 1st, on ease back. I'm wondering what specifically are the plans for May 1st? What does that day look like?
Do you want to go first, Heather? Sure.
Sure. Hi, Nicole. So, I mean, between now and May 1st, I think I outlined some of the things that that we'd want to see in place before that. But also, we are in the process of developing a real process and procedure around how we look and do risk assessments and work with industries and organizations and community for some of these easebacks. I mentioned, for instance, when we look at the evidence and what we know across the country and across the world, looking at elective procedures in our hospital-based system, very important for the health of our population. So over the next week, making sure we have consultation and input from, of course, our health system, which we have, that has already started. So what can that look like going forward? For instance, outdoor activities, making sure that we work with certain organizations and communities. And I'll mention this one because it has been brought up so many times. Of course, angling, and now that is something that will involve different departments and federal and provincial, but it is something that we would go through a process, and it'll be a table with public health doing that major assessment. And so we will not be able to get through everyone at once. We will not be able to tackle everything. But once we do, it'll be important to put some of these, ease back on some of these measures. And then there has to be a period of time where we're very careful and monitor what happens, and understanding that we want to keep our vulnerable communities safe. We want to keep all islanders safe. And so we have to do this very cautiously, carefully, and leaving time in between so that we can assess it before we move on to further measures. So this is going to be rough. It is going to be bumpy, and there's no perfect way to do this. And I will be asking not only for your patience in the last few weeks, but we'll continue to do so. If we don't do this well, then the possibility of having increased measures lifted by the summer will not happen, and then we will be in a very difficult situation. So anyway, I'll start there. Maybe Premier.
I don't have much more to add other than it is important for everyone to remember that this remains a health-led initiative, and what we're trying to find are, for lack of a better word, some of the low-hanging fruit that we can do now while still being able to practice the physical distancing and be very respectful of the public health directives that have been put in place and that remain in place. I think Heather brings up one really important point that we have to not lose focus of, and that is the process going forward, and knock on wood, if we're able to begin that on May 1st, that's providing we can stay on this current trajectory. That it won't be perfect, of course, but and it will be bumpy, and that's a good word she used. But I mean, if you look at what's going on in other provinces and the bumpy and difficult decisions they're having are around the life and death of citizens and the protection of their citizens. And so if we have to have a situation where somebody is a little bit upset because they can't do cycling to the extent that they want, then we will have to endure that. But that's a really good position for us to be in, and quite frankly, I can take that as opposed to what the the opposite would be. So.
Thank you so much. And my second question is for either one of you who can answer this. When will you be making a decision about schools?
Was it schools? Is that? Yeah. We wouldn't be in a position right now for school. A school is a challenging one from a number of perspectives. I mean, obviously, having childcare is connected very closely to that as well. Large gatherings, which would be one of the last things, I think, Dr. Morrison, that we would consider even lifting, and we're not anywhere through that. But we are trying to find a way to how we could potentially look at that going forward. But that would be, Heather, in the second, third phase of this going forward. Yeah.
Yes, I think, Nicole, that's the schools and daycares are definitely a challenge, and we'll be continuing to have discussions with people across the country who are also facing that question, and we'll be in consultation, of course, with the departments here in terms of early childhood and education in the days and the next couple of weeks. So really an important one, and one that as the mom of 4 children, I also have some personal interest in it as well.
Thank you so much.
Louise Martin, CBC.
Hi there. I'm sorry, my phone's a bit crackly, so I hope you can hear me here. So I'm just wondering, Dr. Morrison, how many people on average are arriving on and being screened still on PEI each day, whether it's through the airport or at Federation Bridge?
Hi, Louise. So I did see some of those numbers. I didn't bring them with me. The number, of course, at the bridge is much higher than that at the airport. And we do have daily counts of those. I'm happy to have those emailed to you later today. And I think it got left on a piece of paper that I didn't bring down with me, but it was forwarded to me, so happy to get that to you.
Okay, that's great. Thank you. And I'm also wondering about the role public health has had in providing direction for some of the island's biggest employers, whether food processor or airspace, to prevent the spread of coronavirus in those workplaces. And and perhaps what protocols would be in place if there was a positive case in one of those workplaces, for example, a seafood or potato processor, would that plant have to shut down?
So I couldn't hear really well the whole question, Louise, but so absolutely. For instance, there's been work with our office for some of the industries, and I know and agriculture themselves have been doing a lot of work for certain industries that you mentioned. And the questions around if a case is positive, what happens, and some of it will depend on the setup in these different industries. Certainly, any case, any close contacts, then are removed and self-isolated. Close contacts would have to self-isolate, not just the case, and it would certainly trigger quite a large public health nursing contact tracing if there was a case in a big industry. And then quickly it would become a decision about which we would be discussing with that company about whether you close down the industry. Are always feeling that we should close things down to prevent further spread is always where we would like to err, and I know that would continue with COVID-19 as well.
Okay, thanks very much. Appreciate it.
Rachel Collier at the Eastern Graphic.
Hi there. I guess along similar lines, the province has published a guidance document for farmers hosting and working with temporary foreign workers, and it outlines guidance for practicing physical distancing and hygiene in the workplace and so on. And Dr. Morrison, you've mentioned a similar document for fishery-based industry, maybe in the works. But these are guidelines, so if the guidelines are clearly violated, how would the province respond? Would there be fines, or would the province react by offering support? And this is more in the case, before an outbreak happens.
Hi, thank you for the question. So your point about the guidelines for our seafood processors with temporary foreign workers, I actually thought it may have already been up on the website, so I will check where that is, because I know, I believe it was also finished, so we'll double check on that. And in terms of any kind of concerns or around those, they would be investigated. So if there was a concern raised, and this would have been the same even last year, if there was a concern raised, then it would be followed up, and our environmental health officers would be involved in doing so with the business or with that kind of plant.
And Rachel, if I could just follow up, just from the perspective of, we talk a lot about the buy-in of islanders and how they have been, so thoughtful and have taken on such a responsibility. And that extends to those in our business community. And certainly in my limited time here, the response from our business community and those who are employing islanders through this time, through the because they're essential workers, has been unparalleled. I really think they have tried to go above and beyond to err on the side of safety. And I think it's really been a really strong back and forth conversation between those who have questions and with Dr. Morrison's office and others. I think islanders, and that would include those operating businesses, are really, really erring on the side of caution and health and safety. And I'm really, really proud of how all islanders have reacted in that way.
That's great to hear. I guess in light of talk about easing back measures, could you say where these guidelines fit into that process? I'm assuming specific workplace hygiene practices and 6-foot physical distancing wouldn't be the first to go, but just to hear what your thoughts are about that.
So physical distancing and good hygiene measures, absolutely, you are correct. They will continue to be important. And along with, mass gatherings will not be the first to go. I think our border screening will be important. So we can, when we look at the weeks ahead, those will not change. Our modeling also will help in terms of doing some of these scenarios as we go forward. It's one tool to use as we move forward. But, and I agree with the Premier, we've already seen such good examples in the community and even socially of how we have adapted. And when we look forward, I anticipate there'll be, for instance, businesses who will be looking at models where they are continuing to do some of their business online, for instance, and minimizing the number of people so that they can enable or maintain physical distancing in the physical store. So I think there already have done amazing work in thinking about how it works differently, and I think we'll continue to see that in the weeks ahead.
Okay, thank you.
You're welcome.
Stu Neebe, The Guardian.
Hi, good afternoon to you both. I suppose I'll address this question to both Premier King and Dr. Morrison. As you can imagine, I have a lot of questions about what the talk of a smart ease-back strategy means for physical distancing. I think most islanders are pretty familiar with the ironclad rule of a 6-foot distance, but if we're talking about a smart ease-back, does that mean that those rules change in any way? For example, are small gatherings something that are being considered, or even the reopening of small retail outlets like barbers or physiotherapists or those kinds of services?
So, hi, Stu. Maybe I'll start, and then the Premier can add. And so, absolutely, this is going to be a process, and there'll be many things and many questions to look at over the weeks ahead. But the businesses will not be, I talk about in what we would call the first phase. It would be about the focus on outdoor activities as well as elective procedures in health. And then really the next phase being some of those small businesses in terms and what ones can maintain physical distancing. So in terms of, for instance, and I think that's why each sort of industry, each organization will have some unique circumstances, unique challenges, and that's why we'll be working with them so that we can look at them and do some risk assessment on some particular questions, as you mentioned, around physical distancing and how important that will be, and then what advice we may do to try to minimize some of that risk. And for instance, we've been having lots of questions, and it was raised yesterday about what role, if any, cloth masks would have. And so those will be certainly become more clear in the days ahead. But we think it's important to start the discussion now, because if we are aiming for early May, then we need to start reaching out to our organizations and communities and our health system to make sure that this is in place before that time.
Yeah, Stu, and as we learn to live with COVID, I mean, obviously, the process here would be, as Dr. Morrison outlined in her opening statements, is that we would pick some of the low-hanging things now while adhering to the social distancing, the physical distancing, the other measures we have in place, and then take a 2-week period to sort of measure where things are. And then we look then to the middle of May again to say if we've made some strides here and we haven't impacted health, if we haven't made sacrifices in those regards to our health directives, then we would look at the next phases of that. So this is very much a phased-in approach, a gradual approach, as we talk about. And Dr. Morrison says there will be lots of questions as to the who's and what's and those types of things. We will deal with that as we lead toward May 1st, but we also have to be mindful if we if we take a step backwards here, if we have, a community spread, if we have, the disease or the virus pops up here quickly as it can, then we have to obviously rethink that as well.
Yeah, okay, and I guess just to follow up, I suppose this would be directed to Dr. Morrison. Again, let's assume that there's limited ease back for a 2-week period. What does success look like? I mean, is there a certain number of cases that you'd try to keep hope that the virus stays to, or is it sort of simply keeping community transmission from happening? Like, what would success look like in that case?
So, Stu, that's great. And what we're really talking about, how important that monitoring piece is with ongoing surveillance and monitoring. So it is. Success would be that we continue to have that transmission controlled, and that our health system capacity and our public health system capacity in terms of detection, testing, isolation, and quarantine would remain still have the capacity and still have that ability to control. So that certainly would be part of that picture. It is also looking at making sure our vulnerable populations are protected, and so that's a piece of it. And I mean, there are various sort of steps to it. So success is making sure they're all together, and that we keep. And success for all of us is, what is the purpose of all this? Is to try to control the spread of COVID-19 and minimize the impact for our province. We know those are our two pandemic big goals, and I want to keep Islanders safe, and I think the Premier's talked about that. How do we keep us all healthy and safe, and still be able to move towards being able to see and interact with the people we love, and really everything in between.
Okay, thank you very much.
You're welcome.
Laurent, la voix acadienne.
Bonjour, docteur Morrison. J'avais une question sur le timing. Vous avez dit que le déconfinement prendra du temps, qu'il faudra réévaluer progressivement et régulièrement la situation et que ça va aller pas à pas pour éviter que l'épidémie ne revienne. Est-ce que vous avez une idée sur combien de mois on va devoir vivre avec la COVID-19 ? Est-ce que c'est jusqu'à la fin de l'année 2020, encore en 2021? Est-ce que vous avez une idée aujourd'hui de cette durée?
Bonjour Laurent. On n'est pas certain de la durée, et on parle partout au monde que ça dure peut-être pendant l'année 2020 jusqu'à peut-être le printemps 2021. Mais il y a beaucoup de choses qu'on ne sait pas encore du virus ou de l'épidémie. Ça va dépendre aussi combien de cas, l'impact de l'épidémie vraiment à ce moment, comment longtemps ça va durer. Alors, je ne suis pas certaine, mais je sais que c'est pas pour... on va essayer de vivre avec le COVID-19 pendant pas seulement juste quelques semaines, mais on doit en penser comment est-ce qu'on peut vivre et comment on doit fonctionner vraiment au travail, à la maison avec COVID-19 pendant les mois qui suivent. Alors, je n'ai pas une date définitive, mais j'espère que c'est pas tellement loin, parce que on aimerait tout que ça un jour finisse.
Merci. And I have a second question for you, Premier. You said that the ease back will start on May 1st, and I guess it's 1 month earlier than what was planned initially in the economic update. So I'm wondering, is it a good news that it's 1 month earlier, and do you plan to update this economic update according to this new date?
Talking about the economic update, or Sorry, I didn't.
Yeah, I'm wondering if there will be an update of the economic status of the island, because the easeback will be 1 month earlier than what was planned initially.
Sure, yeah. I think I think Minister Compton is planning sometime this week to come here and to provide an update as to where we're at in terms of finances, what money we have spent out the door, and an outlook on what money is coming in, because even though there is limited economic activity, there is still some tax dollars that are coming in. So she will give an update on that. Like our response from a health perspective, our response from an economic perspective has to be adapted daily. We don't know what the long term of this looks like. We know there will be impacts. If we have any type of tourism season this year, it will be pretty local and a lot smaller than we've been used to. So we have to sort of adjust projections accordingly without knowing to what extent. So it is a challenging time, but certainly I think it is good news that we're looking at doing this in May. But I think we also have to be very cautious and realistic that some of the measures we would be looking at in early May wouldn't have, I would say it would be fair to say, Dr. Morrison, wouldn't have a direct incredible impact on our finances at this point. It would be more the gradual outdoor activities, et cetera. So.
Francois, Radio-Canada.
Good afternoon to you both, Premier and Dr. Morrison. I'll ask my question in English, and I'll ask both of you to answer. And Dr. Morrison, if you could answer in French, that would be greatly appreciated. My question has to do with the communication plan that will be put forward in the next few weeks. If we're looking at easing back some measures, what kind of communication challenges do you envision in the coming weeks leading up to May 1st and after May 1st? As of to what's open, what's not, what we can do, what we can't do. How are you going to be able to communicate this effectively to islanders? Well,
it's a great question, Francois. It is something that we need to be continually working on. I think that, we will need to be clear and concise as we have been in our communication to date. I think that we also will need islanders to be understanding and patient, and this isn't about so much in the beginning, when will such and such store open, as much as it is about, can we get some of our kids out on some bikes and enjoying nature and getting out to that extent. So, look, we do understand that islanders are eager. Dr. Morrison and I would be counted in those, in those numbers. We would like to see life return to normal as quickly as possible, but we also have to understand the responsibility that we have and that all islanders have here. This will take time. This is not perfect by any means. What we do today will be a little bit tweaked in the days ahead. That's just the reality of living and charting a course through a pandemic that there's no map for. So will we veer off and make a wrong turn? Perhaps. We're going to try not to. But we will be as clear and concise as we have been. We will try to be open and honest and articulate in that plan. But it will be a plan that will be rooted in the health and safety of islanders first.
Bonjour. Je vais peut-être emprunter les mots de mon collègue Dr. Strang à Nouvelle-Écosse. Il a dit il n'y a pas un livre que vous pouvez prendre qui parle de la pandémie de COVID-19 parce qu'on n'a jamais eu avant. Alors, on apprend, on essaie de communiquer et de faire nos mieux avec les insulaires ici de l'île du Prince-Édouard. Alors, votre question à propos de la communication, ça va être difficile, mais on va continuer comme on a fait les semaines, les 6 semaines qui ont passé, d'essayer d'être ici souvent, de parler aux insulaires, de travailler avec le média et l'équipe communication ici pour transmettre l'information quand on nous sache et puis d'essayer de faire nos mieux, d'être honnête et clair chaque jour. Et je pense qu'on a les insulaires qui ont tellement bien écouté et puis on a changé leur façon de vivre. Et j'espère qu'on va continuer cette manière d'en parler, de communiquer avec les insulaires.
Follow-up question, if I may. These ease up are, my understanding is they're totally dependent on our borders being as tightly closed as possible. How long do you envision that the current controls that are at the bridge, at the airport, and eventually at the ferry will remain in place?
That is a great question, Laurent. And your last question, in which I didn't translate into my response in English, but it almost goes on from there. I mean, the communication challenges that we will have in the weeks ahead, but we rely on making sure we're open and communicating as soon as possible with islanders. And in terms of the border, that will continue to be another area of communication but we'll be looking at that. Right now, at this point in time, our risk of importation of cases remains high based on our epidemiology of the pandemic for Prince Edward Island. And so at this point in time, we will continue to reassess, readjust, relook at that date in terms of our border measures. It will also depend very much on what is happening in the rest of the country. What is happening in New Brunswick? What's happening in Nova Scotia? What is happening to other in other places in the country where people are coming from? So we will be not just looking at what's happening here, but it will be also looking at what is happening elsewhere as we move forward in the weeks ahead.
And Francois, just to follow up on Dr. Morrison's point, I mean, if the part of the job here is trying to forecast out into at least the near future what it could look like. If there's a flicker of hope here, I think it's our sister province in New Brunswick is in a similar situation that we are in terms of their case management and what they've done to date. They have a lot of very similar measures in place with their points of entry, et cetera. I've talked with Premier Higgs from New Brunswick in the last few days just about certainly not in the initial phases, but later on into the summer, what some type of interprovincial travel could or should look like in concert with our chief public health offices in New Brunswick and PEI. So you have to be looking out toward that. I mean, it's premature to say that the bridge will open to free traffic on such and such a date. We're not in a position to do that. We have to err on the side of health and safety here. But I think that, at least for today, April 21st gives me a flicker of hope that, there is some positive news on the horizon, but I would equate it to like walking to a small town in Saskatchewan. You see it out there and you keep walking, but you don't seem to be getting any closer, but eventually we will get there. So I feel it's a similar type of feeling here right now, but hope is a big word. Dr. Morrison led with that. Hope is a big word here, and I hope today this gives Islanders that flicker of hope that there is some good things on the horizon, but there's a lot of hard work that remains too.
Thank you.
Thank you. So thank you. I think that brings an end to the media conference. Thank you very much to our friends in the media for being here and to keeping Islanders informed. So thank you very much.